starts with swastikas, but it's not just that. That's the easy one to name, right? It's being called dirty Zionist. It's being called colonizer, white supremacist, you're a baby killer. And those are things that my patients were telling me, that their peers were telling them. And to stop inviting them to places. At school, when
these are children.
Those are, K-12. Social isolation, school avoidance, anxiety, sitting in class, and if they're learning about social justice or about history, some of them were shaking. Some of them were told, get out of the classroom because this is too much for you, or you cannot talk about this subject because you're biased. Some were literally called liars for bringing their own perspective as people who grew up in that area. So when they're being bullied for something that is such a core part of their identity, you can't expect them to feel safe. It's like saying that if someone is part of the LGBTQ community and you're telling them this part of your identity is not welcome here. It's a core part of someone's identity. It's an existential threat. And when people are under these type of threats for a long period of time, and this has been a long period of time, they're going to have more symptoms. They're going to have more anxiety. Around the 80s, there was a study about adverse childhood experiences, and they showed that people who have more adverse childhood experiences throughout the years will have more mental health issues, substance abuse issues, medical issues, and actually would die earlier. What's been happening in the last year and a half, and I would argue that for a lot of Jews, which I wasn't aware of because of anti-Semitism, probably even before October 7th, has been adverse experiences, one on top of another one. And trauma is a wound. It's a scar. It doesn't go away. And when you have another scar on top of a scar, it's really hard to heal.